Okay, so today we are going to discuss bloody diarrhea station from critical care. A 42-year-old lady came to emergency department with abdominal pain and bloody diarrhea for 10 episodes. On examination, patient was hypertensive, tachycardia, feverish, low registration done. Diarrhea stopped after 6 hours. And labs are HB 8.2, chrome platelets 66000, WBC is 12,000, sodium 129, potassium 2.8, CRP 510, grit 109, and urea is 9. You will be shown a full blood count. What is the type of anemia? So microcytic hypochromic anemia, low MCV, low MCHC. So low microcytic anemia is basically this occurs due to blood loss. Low MCV, microcytic hypochromic anemia. Why is and HB is also low 8.2. Why is platelet elevated in this report? Secondary to acute inflammation, dehydration from diarrhea. Dehydration can lead to increased platelet as well. What are your differential for this patient having bloody diarrhea? Ulcerative colitis and Crohn's disease, IBD, inflammatory bowel disease, ischemic colitis, amoebic colitis, bacillary dysentery, carcinoma colon, infective colitis by Clostridium difficile, Campylobacter jejuni, injury dysplasia, and diverticulitis. Okay, so what do we see in this X-ray? So this is an X-ray of abdomen, erect abdomen X-ray. Dilatation of the ascending and transverse colon. You can see the dilatation of the ascending and transverse colon. So this is large gut. Okay, and so this is a dilatation of the ascending and the transverse colon, and with narrowing of the descending colon with thumbprint sign. Thumbprint is a radiographic sign of large bowel thickening, usually caused by edema related to infective or inflammatory process colitis. The normal host become thickened at regular intervals, appearing like thumbprints projecting into the irritated lumen. So these are the thumbprint sign. These are the thumbprints. So this is the thumbprint sign. So what this signifies? Thumbprint sign usually signifies ischemic colitis or any other inflammatory or infective process. So why would you transfuse blood to this patient? Why? Patient is in a state of sepsis, not indicated as HB is 8.2. HB is 8.2, so there is no need of HB blood transfusion. Plus there is the diarrhea has been stopped, so there is no need. In acute cases where when to transfuse HB, it's 9 on 9 HB, and when there is active bleeding, so you can transfuse the blood. Yes. Okay, so here it's also mentioned that blood transfusion for acute condition HB less than 9 or 9, chronic condition HB less than 7. So in acute cases when it's 9 or less than 9, in chronic cases when it's less than 7, so you can transfuse. Okay, and now further, wait. Why is there hyponatremia and hypokalemia due to loss of diarrhea? You can easily answer this. What are the other investigations you would like to consider? Since it is an inflammatory condition, so we will do CRP. CRP will be raised. ESR will also be raised. In addition, stool analysis and culture for microbiological assessment. Antibodies for IBD, C-ANCA and P-ANCA. Fecal calprotectin. Fecal calprotectin for IBD. Carcinoma embryonic antigens, CT colonography. When acute episode subsides, I will consider colonoscopy as well. How will monitor the patient response? Clinically, fever settles, diarrhea stops, and decrease CRP, decrease TLC. What are the indication of urgent surgical management? Toxic megacolon, Okay, so in these surgical conditions, you will go for surgical intervention when there is toxic megacolon refractory. Toxic megacolon is a complication of the IBD, inflammatory bowel disease. It can occur. Refractory to medical management. Fulminant colitis, uncontrolled colonic bleeding, perforation free or walled off, obstruction and stricture with suspicion of cancer. What are the surgical management? Panproctocolectomy with ileostomy followed by uh, IPAA. So IPAA is ileoanal anastomosis. So you will remove the whole colon, and you can do ileoanal anastomosis, but not for Crohn disease. Still, you can have in the anal region. Uh, since Crohn disease can involve any part of the gut, but most commonly it occurs in the terminal ileum. And IBD, usually we know that colon and rectum is usually involved. So for colon and UC, you can do ileoanal anastomosis with safely. But for chronic Crohn disease, you cannot take a risk because it can also occur there as well in the residual gut. Subtotal colectomy with ileostomy. So this was the